waking up Hamilton, Halton, and Niagara with a great sunrise. This is CH Morning Live for Tuesday, March 28th. Good morning. .23 on CH Morning Live. Thanks for starting your Tuesday with us. Well, getting a good night's sleep can sometimes be difficult, especially when you work on a morning show. Who put that in there? But more so for those affected with obstructive sleep apnea or other sleep disorders. There's actually a huge list. Thanks for joining us. Dr. Howard Awad is actually National Sleep Awareness Week. Okay. And we're all very aware, yes, working on a morning show, we're shift workers. I mean, sleep is so important, and there are a lot of disorders. But the one, your clinic, and actually we'll mention the website right now because you're part of the sleep medicine group. And the website is sleepawake.com. Great information and great clinics in Burlington and Oakville, dealing with a wide array of disorders, but this morning, right up in the top of the list, and something you deal with a lot, is sleep apnea.
Absolutely.
How big is this problem in Canada?
It is huge in Canada, and we are only seeing the tip of an iceberg. Numbers are 5 to 10%, and in fact, there is maybe evidence that we may be looking into 15 to 20%.
Give us some numbers and an overview of this condition for those not familiar with it.
Absolutely. More common in men. Men, about 10% of them will be affected, maybe about 5% in women. Children are also affected because the disorder is hereditary disorder and it runs in families. 2 to 5% of kids at any given time will be suffering from significant snoring and from sleep apnea.
Yeah, not surprising this is hereditary. This is basically a constricted or a narrow airway.
The definition, we now know sleep apnea is an abnormal airway. People are born with a narrow airway and weak upper airway muscles that support the airway during the course of the night.
So what do you do for treatment at the clinics?
Again, making an accurate diagnosis is the first step. Then, depending on the severity of the sleep apnea, we look into the most appropriate treatment. Very mild cases, healthy lifestyle changes. Go to the gym, work out, lose weight, cut down on alcohol, and if somebody smokes, stop smoking. Why smoking irritates the upper airway, make it more congested. So if you are looking into a narrow airway that is becoming more swollen at night, the difficulties breathing are going to become much more prominent. Alcohol relaxes the throat muscle at night, so it causes more collapse of the airway. As we progress into more significant forms of sleep apnea, we look into surgery and we look into dental devices.
But there's actual appliances that could be.
Yeah, dental device done by the dentist, but it has to be done by a certified dentist, so they do a proper job, because they are costly and they can cause problem in terms of the temporomandibular joint. So it needs to be done in somebody who has experience. But the most decisive treatment is CPAP. Continuous positive airway pressure.
Now, snoring with kids too, which is related and perhaps more common. I mean, that's something you're often dealing with as well.
Absolutely, absolutely. With kids, snoring is a problem, but frequently kids present with hyperactivity, academic performance problem in school, and also short attention span. Lots of kids who have sleep disorder are labeled hyperactive and or labeled as troublemaker at the school, and
or attention deficit problems, which may be related to
very much related, because one of the common symptoms of sleep apnea are short attention span and memory problem.
Yeah,
so
something to be investigated.
Absolutely.
Yeah, and of course you deal with everything from garden variety insomnia as well, which can be in a number of stages and extreme cases. I wish we had more time on this, but certainly we direct everyone to sleepawake.com. Great website, and you can actually see the clinic. Thanks so much for joining us on Sleep Awareness Week. We're going to nod off for a couple of minutes and we'll back up and fresh with the news at 8:30. Thanks, Dr. Awad.
My pleasure. Thank you.